Hello, everybody, and welcome to Lifestyle Medicine Grand Rounds. I'm Dr. Ted Barnett, the president and founder of Rochester Lifestyle Medicine Institute. Every patient is different, and they all have their own unique issues, and they present their own unique challenges to their clinicians. So this is a way of discussing a real life case. And in fact, tonight we have two real life cases. So Dr. Kerry Graff is our presenter tonight, and she has something called We're Just Getting Started, a tale of two patients. And we have our regular panelists, Dr. Melissa Sunderman and Dr. Robert Brakey, and our guest panelist tonight is Dr. Neil Barnard, the founding president of the Physicians Committee for Responsible Medicine. And yeah, thanks to one of our very generous donors, all of our CMEs are free. You can learn more about that on our website. Tonight, our guest panelist is Dr. Neil Barnard, who's an adjunct professor of medicine at the George Washington University School of Medicine, and he's president of the Physicians Committee for Responsible Medicine. He's led numerous research studies investigating the effects of diet, and he's authored more than 100 scientific publications and 20 books for medical and lay readers. He's also the editor-in-chief of the Nutrition Guide for Clinicians, and he's a fellow of the American College of Cardiology and founded the Barnard Medical Center in Washington, D.C. as a model for making nutrition a routine part of all medical care. Our regular panelist, Dr. Robert Brakey, is board certified in family medicine and lifestyle medicine. He's been a family physician in Ann Arbor for 36 years and serves as the medical director for IHA's William J. Folletti Institute of Lifestyle Medicine, as well as the chair of IHA's governing board. He's also on the board of directors for these two national organizations, the PBNSG, or Plant-Based Nutrition Support Group, and PPOD, Plant-Based Prevention of Disease, and annual conference. He has a special interest in employing lifestyle medicine approaches for disease reversal. And then Dr. Melissa Sunderman is board certified in internal medicine and lifestyle medicine. She's been practicing for over 20 years and is currently at IHA East Brighton Primary Care. She's trained in integrative medicine, completed a professional training program in mind-body medicine, and is a member of the Academy for Eating Disorders. Her clinical interests include lifestyle medicine, plant-based nutrition, food as medicine, and sports nutrition, and she's an avid endurance athlete and is outdoors as often as possible. And Dr. Kerry Graff will be presenting the two cases tonight. She's a local Rochester physician. She's board certified in both family and lifestyle medicine. She serves as the lead lifestyle medicine physician for Rochester Regional Health in Western New York, which is based here in Rochester. And she works to integrate lifestyle medicine throughout this large healthcare system. She's the co-author of the 4-Leaf Guide to Vibrant Health, using the power of food to heal ourselves and our planet. And I'm going to skip over Dr. Susan Friedman because she's not here tonight. And you all know about me. So I'm going to try to get to the case now. And we are just getting started, a tale of two patients. And I'm going to turn it over to Dr. Graff. And if our panelists could turn on their videos, maybe they already have, that would be great. So Dr. Graff, take it away.
Hi, everybody. It's great to have you here tonight. I'm really excited to present these two cases, really contrasting cases. So give me.
Fantastic.
So this is actually was from a morning where I had a student with me. I had a number of lifestyle medicine consultations that day, but these were only a couple of hours apart, both in the morning. And I really was excited that the student got to see them, because these two cases that on the surface looked really similar. The women were both about the same age. They were both referred from primary care for obesity. They had a number of similar medical issues, but the plans were completely different. And so I thought it was like a really great demonstration of why we're really looking at all 6 pillars of lifestyle medicine when we're doing an initial consult. I think we all know that food is where the money is, right? It's where people are the most far off almost always. And when you fix that, you fix a ton of stuff. But if you don't have the back end of lifestyle medicine right, you really struggle to make diet changes on the front end. So that's really what this case report is about. So I see a new consult that comes in. Ted was asking me what the heck this weird slide was in my slide deck, and I'm like, I see a new lifestyle medicine consultations being like my daughter's jewelry box that she just dumps out on the table in front of you and tells you to untangle, right? So it's all of the patient's medical problems, what current medications they're on that might kind of hamper their ability to do things. It is what they're doing in their lifestyles. It's also what skill sets they have. Do they have, can they cook? What kind of crazy lives do they lead? Do they have, 6 kids that they're running around? And it's looking at the whole picture and trying to find a way forward. And, we all know that we've got to get to the middle of that and untangle the middle of that, but you kind of have to tease it out at the edges to figure out where the heck you're going. And you've got to get a really good view of the whole thing before you really be able to find a path forward. So the first case, I need to move that out of the way. Okay. So the first case is 29-year-old female. We're going to call her SC, who was referred by her primary care physician for lifestyle medicine consultation for obesity. Medical conditions included morbid obesity, hypertension, fatty liver, prediabetes, anxiety, depression, and ADHD. If you've been in lifestyle medicine at all, you kind of know that these friends like to run together, right? So you get one problem, you kind of usually get a bunch of them that are pretty similar. Her goals, what she stated was to get to a healthier weight and to feel comfortable in my own body and confident in myself and develop better eating habits. After kind of going through her list of problems, I added, with her permission, reversing prediabetes, reversing the fatty liver disease, and reversing hypertension. But reversing her medical problems really wasn't the forefront of what she was thinking about. She's really thinking about weight and feeling good in her own body. Her medication list for her hypertension, she's on lisinopril hydrochlorothiazide 10/12.5 milligrams daily. She was on Adderall for her ADHD, 10 milligrams POBID, fluoxetine for the depression. She also had anxiety, so it's kind of funny that she's on Adderall and fluoxetine, which don't work that well for anxiety, but 40 milligrams PO daily, and she was on a birth control pill. From her vitals and initial pertinent positives from her exam, she was 5'4.5" tall, and weight was 315 pounds, so her BMI was 53.2. Blood pressure was in normal range, but that was on 2 medications, right? Heart rate was high at 98, which isn't surprising when you see somebody who's obese, but she also was on Adderall, so that might have contributed to it. Respiratory rate and O2 sets were normal. She was morbidly obese, but well-groomed, and other than being obese, she was healthy appearing, good eye contact, she was very appropriate, and nothing else was remarkable on her exam. In the 2 cases that I'm going to present, I did not put their labs in just for the sake of time. They did fall in the pre-diabetic range, and their lipids were both actually fairly good. Their HDL, the cholesterol HDL ratios were actually less than averages for heart disease. Both had triglycerides that were slightly high. Okay, so we know the 6 lifestyle medicine pillars, right? So there's the first 3 on the front, the fingers, forks, and feet, smoking, alcohol, and drug use for fingers, what we're eating for forks, and physical activity for feet. And the CDC and World Health Organization both agree that those 3 things are responsible for about 80% of all the health misery we see here in the US. But we've got 3 more pillars in lifestyle medicine on the back side, on the flip side: sleep, stress, and love, which is good relationships or having something in your life that you're passionate about and want to be alive to be able to do. So I call those the backside. And so we're going to look at all 6 of these. I usually start with a patient with love. And that really came out of a talk by Dr. Dean Ornish many years ago. And it was really about how patients will often come to you initially with a fear base. But fear is a terrible long-term motivator. It only lasts for 1 or 2 months, and then the patient goes back to doing all the things that got them into trouble in the first place, because it feels bad to motivate yourself to try to engage in better, healthier behaviors by freaking yourself out that you're going to die or bad things are going to happen if you don't. And if you don't fix, if somebody doesn't have anything in their life that they love that they want to make change for, you're not gonna, it doesn't matter what you tell them about what they should be eating, they're not gonna be able to stick to it for more than 2 months. So, whoops, I moved back here. So, okay, so love. So in our first patient, I asked her what she loved enough that she would be willing to make changes for, and she had a lot. Her family, she was particularly close to her sister and her brother. She has a very large extended family with cousins and lots of nieces and nephews, and she was close to all of them, and she also has a lot of friends. She works at a daycare, and she loves her kids at the daycare and just being with kids in general. She is single, but hoping to meet a guy for a long-term relationship and would like to start her own family. So a really good motivator for weight loss, because it might be difficult for her to get pregnant with a BMI of 53, and it certainly wouldn't be a low-risk pregnancy with that. And then she currently lives with a roommate with whom she gets along very well. So she's in a very supportive living situation where she's got people who are supportive right around her. So like I said, I usually concentrate on the back half first. So I asked about sleep next. She sleeps from 11:30 to 6:30 a.m. So she's getting 7 hours of time kind of in bed, right? So she's shortchanging herself a little bit there right from the get-go. But then she also repetitively wakes at night, never feels rested. She falls asleep very easily during the day if she's given the opportunity. She came to me with a sleep study already scheduled, which is great. I try to let the folks who tend to refer to me to make sure everybody's got thyroid testing, and if there's any suspicion for sleep apnea, to at least get that brewing, sleep study brewing. She reports that if she doesn't take Adderall after work, she will get nothing done at home in the evening. She's just completely exhausted and will just sit in front of the TV and fall asleep. And even when she takes the Adderall, she's still watching a lot of TV in the evenings because she's just too tired to do much of anything else. And she usually falls asleep with the TV on. Okay, stressors. So in terms of stress, I look at what somebody's stressors are and then how well they have a stress management plan. So her stressors, she reported her weight and her health issues, but she said that really these were pretty mild stressors for her. She didn't get really worked up about any of that. Occasionally working at the daycare, mostly coworker issues, almost never the kids. And again, it was mild stress for her, nothing major. She has a little financial stress. Obviously, she doesn't make that much money as a childcare worker, but she's able to cover her basic bills, and it's not terrible. So there's just mild stress there. The biggest stress that she reported was that about a year prior to seeing me, her mom died unexpectedly. And basically, this patient had texted her mom, and her mom wasn't answering, so she went over to check on her and found her dead, like out of the blue. But she was doing really okay with it now. She wasn't particularly traumatized by it. She was functioning really pretty well. Her stress management, what she listed in terms of stress management wasn't actually what she was doing. So it was kind of interesting. She does say that she stress eats at times, that she will stress shop, and that she will watch TV to kind of distract herself. But most of the time when she's eating, shopping, or watching TV, she's not doing it because she's stressed. She just is doing it because she's doing it, and it's a habit, but she rarely has to turn to it for stress management because she doesn't really feel very stressed much of the time. After we kind of dug around a little bit, she did report a couple of healthy stress management plans, which was playing country music, in particular, singing along with it and dancing to it in her house, and calling her cousin with whom she's very close. So she's got to phone a friend, phones her cousin if she really needs to kind of vent something and talk through something and get some support. Okay, so for fingers, so going back to the fingers, forks, and feet on the front end. For smoking, she vapes nicotine a few times a month. Usually she's doing it if she's already taken her Adderall and she's still falling asleep, she'll use some nicotine to keep herself awake. From an alcohol standpoint, she's drinking 1 or 2 drinks twice a week. It's almost always in a social occasion, and she doesn't use any illicit drugs. And then feet, she works at a daycare, so she's active during the day, kind of playing with the kids, but she doesn't do anything outside of work. She has no idea how many steps on a day she's getting on average, and she says there's absolutely no way that she could actually take a walk after work. She's just really exhausted and just wants to sleep. In terms of forks, fruits, 0 to 1 serving a day, vegetables 1 or 2 a day, whole grains are about once a week, no beans, potatoes twice a week, no walnuts or flax seeds, about 4 eggs a week, dairies 3 to 4 servings per day, usually while she's at the daycare. Meat and fish is 2 to 3 servings a day, processed foods 5 to 6 a day, oil is 3 tablespoons a day. She drinks absolutely no water or anything else that isn't caffeinated. She drinks 1 to 2 cups of caffeinated liquids a day. She does have cooking skills, but she has no energy to actually do any cooking. And she eats both breakfast and lunch at work. She doesn't actually pack anything. She grabs whatever is around that the kids have on hand at the daycare and eats that. Her overall estimate of whole food plant-based calories is less than, well, it's about 10%. It's my kind of rough estimate of what I think she's eating in terms of that. So I like to use that as like if you kind of say the folks in blue zones, the folks who live the longest on the planet, they're getting 80% of the calories from whole plants. Average American is getting somewhere around 10, and she's like your average American. Okay, so we got poll question 1. So which of this patient's lifestyle medicine pillars is the furthest off from optimal? Is it fingers, forks, feet, sleep, stress, or love? So put in your in your thought on that. And then the second question was also listed, that comes on the next slide, but it's up on the poll here. Which 2 lifestyle medicine pillars would be the top priorities when developing a lifestyle medicine plan for the next 6 weeks? So usually I do follow-ups in 6 weeks. It kind of depends. If people need more support, I might see them a little bit sooner, or I could refer them to our nurse who serves also as a coach, who can see them weekly if somebody needs a lot of support. So you can fill both of those out and then submit it. Okay. So it looks like everybody was pretty much in agreement that it was forks, and I completely agree with you there that that her forks is really way off. And then what did we get for the second one?
Oh,
So
you have to
50
scroll down.
Yeah, so 50% said forks and feet, 17% said forks and stress, 33% said sleep and forks. So I would love to hear from the panel what they think about this patient and kind of where to start with her.
Yeah, so let's start with Dr. Barnard.
Okay. Well, first of all, just as you said, Kerry, she presents with problems that affect a lot of people, and you get a whole group of issues together. She's got weight problems, but she has everything else that came along with it. And I think you're absolutely right that the issue really is food. But I like the way you're attentive to the other things. But I would say that they're not necessarily causing her problems, but what they are is a menu of things that could be interfering with the solution. And the reason I put it that way is sometimes people think of these 6 pillars as things that all have to be right in order to get the patient to their goal. But I remember William Castelli at Framingham once telling me that during the occupations that occurred during World War II, when the occupying soldiers took away all the cows and so forth, the stressed out occupied populations ate better than before, and despite their stress, were healthier than before. The point that he was trying to make is sometimes you're not solving a person's stress, but if their diet is better, they're going to get better. Or another example is, let's say you have a person who's overweight and they're smoking and you haven't been able to get them to stop smoking now. You definitely want to, but it's not particularly important for getting that goal solved necessarily. So I like the idea that you've taken a really good audit of where she is. You've identified her issues. I think food is number one. And the idea of the others is, could stress, could lack of sleep, lack of support interfere? But I think you've sniffed out that she's got a huge asset. She's got a lot of people who care about her. And the flip side of that is she doesn't have a lot of, it doesn't sound like she's got a lot of social stress that's driving her to the kitchen.
That's great. So thanks for that, Dr. Barnard. Dr. Sunderman.
Well, I love your approach for this history taking, Kerry. I'm going to echo what everyone else is saying and just hitting all those pillars and starting with some that I think that if you weren't familiar with the pillars of lifestyle medicine in our patients, to start there, I think it's great. I also applaud this young woman for doing a lifestyle medicine consult. I mean, she's a pretty young person, and I loved her goals. Of course, she says losing weight and getting healthier, but I loved that she said, I want to be comfortable in my body and confident in myself. So I think when we were looking at, number on a scale, right? Is that rewarding? Yeah, it's a number on the scale. But when we can, frame it as, what do you really want in life, right? And I think she articulated that really well, is like, I want to feel confident in who I am, and really capitalizing on that. I totally agree with Dr. Barnard that food is a great place to start. And I think just by optimizing that, what that's going to do for, we know the gut microbiome and how that ticks all the other pillars. I think that's where we need to start. But I think she's coming in with the right goals and has like that social support system. One question I'd want to know, because, I'm the nature is medicine person, and just her job at the daycare, maybe they do go outside, but I want to know, does she get outdoors at all? Because probably when she comes home, she's just watching TV, and we know that nature is so healing. So I'm wondering if she does get any outdoor time or anything like that, and whether that should, eventually be recommended.
That's great. Dr. Graff, can she get outside at the daycare center?
She does. She gets outside with the kids. And that's actually when the other teachers don't want to go outside, she's always the one to go.
That's great. I like that.
Great.
She has
Dr.
a lot of, she said that she wanted more confidence in herself, but if you saw her, she's extremely personable. She wasn't somebody who was really uncomfortable with her weight in terms of getting out there and being around other people.
Yeah. So
which
it's
was
almost
really
like
a
giving her
plus.
the right tools, right? And just like, feeling, just more confident in her own body. But that's great that she already presents herself like that.
Yeah.
Yeah, super. Dr. Breaking, any comments?
Yes, first of all, thanks, Dr. Graff. Again, great overview of what's going on for this young woman's life. And I like that you really framed it in what's important for her, because that's what allow her to find and then stick with the lifestyle medicine approaches that will really help her out of this. And I agree with Dr. Barnard and the sense of the group that without the right nutrition, it's hard for the rest to follow. I think the brain's an organ like any other, and when it's in a pro-inflammatory environment without the short-chain fatty acids from the microbiome, when it's not getting the antioxidants needed from fruits and vegetables, it doesn't work very well, and it doesn't make the decisions. And it's interesting that her stress relievers are eating processed and animal foods and watching TV, which are, of course, counterproductive to really getting to all of these pillars. So I think that, again, by focusing on getting some better nourishment in her system, it will help all aspects of this. And then we'll develop the synergies between the pillars. She'll sleep better. She'll feel less stressed. She'll be able to lose weight and get out and exercise more. And you didn't kind of mention it, but it looks to me from her diet like she's got a bit of carbophobia. She eats no beans and 1 or 2 whole grains a week. She's on mainly a meat processed food and kind of vegetable diet that is counterproductive, as we know, to nourishing microbiome, to her weight loss goals, and to helping her to really get out of the starting gate to getting going. So I think as you kind of transition to what are we going to do from here, I'm looking forward to seeing how we can bring the lifestyle medicine forces to bear and really help her, because she's ripe for getting some help from what we have to offer.
I was just going to add on one thing on things Bob for bringing up what she does for relieving stress, and it's eating, it's watching TV. It's kind of these zoning out things of just kind of like tuning out, right? And I call that sort of this passive, self-care shopping, right? So instant gratification might feel good at the moment, but does that really do anything to minimize your stress? And in most cases, no. So, just really trying to educate about other ways of, what can be stress relieving. For Ted, it's bringing his tape recorder and his binoculars, going to look for birds, right? For me, it's going for a run outdoors. So educating about how stress relievers doesn't have to mean numbing yourself, by just eating mindlessly and watching TV and Netflix. And I do like it when she calls her cousin, right? Because that's an active role of stress relief and connection. So I think just deciphering what people think is relaxing, sometimes it's just kind of numbing ourselves.
Yeah, great. That's great. So Kerry, you want to take over?
Yeah,
again?
I also wanted to just get why is this not going?
So I think we're done with
So
the
I
poll,
just
right?
wanted to know what people thought was the second thing we're all paying attention to forks, right? So
Right.
number 4 is out, but which of the other ones is the most important? Do we think it's feet? Do we think it's stress, or do we think it's sleep?
Right. So we got the answers there. Looks
Right.
like 50%. Go ahead.
Yeah, most people thought that it was sleep, but nobody really talked about that in the panel. So I was just wondering.
Please.
Go ahead.
I'm Alberto Nassif. How are you?
Yeah, but
Yeah, that's a fantastic and very artfully done assessment of a patient. One thing I like to do with patients is, I look at them. I actually measure their necks. I carry a tape measure in my pocket, and I've actually gotten pretty good at looking at somebody's neck and knowing the size of their neck. I should have been a freaking tailor, but then I look in their mouths and I look at their Mallampati score, or the Mallampati configuration, which is how high the tongue arch is, how low the soft palate is. And then I actually put that in my note at every visit for patients that I suspect sleep apnea. And patients that snore don't know the snore. They just wake up tired. They get a dry mouth. So that's another key question. And they wake up with a headache, which is another thing that can happen from the recurrent episodes of apnea. So for me, listening to that, I'm hearing, wow, we got to really address her sleep, at least investigate it, because it's such a huge issue that people don't know anything about, and they don't know that they're snoring unless they have somebody that sleeps with them and doesn't snore,
Yeah,
right?
she's really exhausted. So
Yeah.
I wonder, is she using food at night as well, trying to keep herself awake? Because she's, if she doesn't do the Adderall, she can't stay awake. If she's not doing the nicotine, she can't stay awake. So,
I just
It's great.
say
So,
that-
Kerry, actually, in the interest of time, Kerry, we probably should move on.
all right,
Alberto,
sorry.
that was great. Thank you for that contribution. Maybe at the end we can hear more from Alberto. Thank you.
Okay.
That was
So
great.
the initial lifestyle medicine plan for this patient: get her sleep study as planned, listen to country music to help relax after 9:30 p.m. rather than watching TV, getting her into bed earlier, in bed lights out at 10:30, so it'll give her a whole 8 hours for when she needs to get up in the morning. Try using a gratitude review to fall asleep or to get back to sleep if she wakes up during the night. There are two kinds of gratitude reviews that people tend to use. One is 3 good things from the day and why. That's not the one I'm going to talk about here. Gratitude review in this case is everything you can think of from the day that you are grateful for with your eyes closed as you're trying to fall asleep. I usually get through 7 things and I'm out, rarely past that. And then I had her track her steps on her Apple Watch. So she had an idea of baseline number of steps that she's getting in every day. So that's the only feet one that went on the list for the first one, for the first plan. I asked her to buy enough glass containers with plastic lids to pack breakfast and lunches by the week. So she could get all of her breakfast made and her lunches made and be able to grab and go in the week. I asked her to try overnight oats. She'd never had them. She didn't know that she liked regular oatmeal, but I wanted her to try the overnight oats because it's a little bit easier to batch cook those. And then decide which one she liked better and batch cook it on Sunday, then pack it with fruit for breakfast at work using an almond or other plant-based milk. And then make a big pot of plant-based soup on the weekend to pack for lunches along with 2 more fruits. And the idea was that she's taking a whole bunch of whole plant foods from home that she would eat at her work so that she wouldn't be eating all of the crap food that was given at the daycare. She got a recipe resource list along with a whole food plant-based and me booklet, which I really like to use. I asked her to never let herself get more than a 7 out of 10 on the hunger scale. With 10 out of 10, you'd be eating cardboard, and 0 out of 10 is you just ate Thanksgiving dinner and don't give you another bite. So once you hit 8 out of 10, people will start craving the most calorie dense foods they can get their hands on. So intervene at a 7 out of 10 with something to eat. If she gets hungry between meals, snack on fruit or baked sweet potato. And I love the trick of batch baking sweet potatoes on the weekend to use as needed. And use parchment paper so that you can just like toss out the paper and not have to scrub the pan that they come on. That's really nice, and it works much better than microwaving sweet potatoes, which get kind of weird on the edges. I asked her to avoid dairy as much as you can. We talked a little bit about something like growth factor 2 in that, and basically you should remember you're not a baby cow. You don't want to grow like one. They grow a lot in that first year and a half. And then I needed her drinking more water because not because it makes her feel full in her stomach, but because we misinterpret the signal between being thirsty for being hungry. So part of why she might be eating so much is that she's actually thirsty, but she's eating instead of drinking. And the plan was to have her do 24 ounces of water by lunchtime and another 24 ounces before leaving work for the day. So 24 ounces in the morning and 24 ounces before she would leave work for the day. And she definitely didn't like water, but she did like flavored and sparkling. So I let her have whatever. It wasn't supposed to be diet, but some sort of flavored water. Okay, and then I saw her back in 6 weeks. And the summary of how she did at her 6-week follow-up: she was sleeping much better. She was following the routine and getting about 8 hours in bed very consistently. She still wakes up frequently at night, but falls back to sleep easily. She hadn't been needing to use the gratitude review at all for sleeping. She feels a little bit less tired, but still pretty bad. She needed the stimulant in the afternoon to be functional in the evening still. She got her sleep study and it showed moderate to severe sleep apnea, but she hadn't gotten set up with her CPAP yet. So we didn't have any idea how that was going to work for her. She was getting 7,500 steps a day on average, which isn't too bad. She did buy a bunch of containers and she's loving her grab and go breakfast and lunches and is batch doing her overnight oats, making a big pot of soups for lunches. She's eating much less processed food, and she was eating a ton of dairy at the daycare because they had cheese sticks and yogurt always there. But she isn't hungry while she's there because she's eating her own food that she brought, so she's eating a lot less of that stuff. She is getting her 48 ounces of water in daily, although it turns out that she was doing 16 ounces of her bottles of water were 16 ounces, and so it was a little bit weird with the timing, so we did change that for her next plan. And her whole food plant-based percentage of calories was up to 60% from 10%, and she was down 8 pounds already. So she was really happy about all of that. Her next lifestyle medicine plan was to start the CPAP. And then I just gave her a whole lot of support. Like, you might be uncomfortable when you first start it, but you're gonna start and keep working with it. If you might need a different a new appliance, just keep working if you're having trouble with it until you figure out how to tolerate it. Continue batch making breakfast and lunches. We switched her water because what she usually gets is 16 ounces. So it was 16 ounces by lunchtime, 16 ounces with lunch and into the early afternoon, and then another 16-ounce bottle late afternoon through dinner. Because she still had no energy in the evenings, and I wanted to try to introduce more whole food plant-based food in for dinners, I had her try Sweet Pea, which is a whole food plant-based fresh meal delivery service we have here in Rochester. I wanted her to try out a sweet potato, half can of black beans, and a bunch of salsa as a quick dinner, something that she could make really easily, even if she has no energy, or she could use it as a weekend lunch. And then I asked her, as she had more energy, to try making one new whole food plant-based dinner on the weekend that would then give her a leftover dinner or two to eat during the week. So she doesn't have energy really to cook during the week, but if she does have more energy on the weekend, so if she could make something then that would give her leftovers, that would be a couple of meals that she wouldn't have to buy that somebody else made for her. And so
All
that's
right.
it on this one.
That's great. I'm going to ask, so we have to keep moving, but Dr. Barnard, as our guest panelist, do you have any comments on where we are now?
Well, several things. First of all, you established a terrific alliance with her. It sounds like right out of the box, she knew you cared about her. And she told you her issues. You got to know her, it sounds like, very quickly. And if I'm right in understanding this, you had one visit with her. And then after that, she made a lot of changes in her life. And basically it worked. She's lost more than 1 pound a week. That's really impressive. So that's a terrific thing. I am going to guess that if she continues to get support and continues to lose weight, her sleep apnea is going to get better. As that gets better, her blood pressure is going to come down, and that will then be reinforced more and more changes. The one thing I would emphasize is that we've been guessing about different things with her, that she's watching TV as a stress reducer. She says she is, but we don't really know the importance of these things. What we can do is, based on what she's told you, is get hypotheses about what's going to get her off track. She's going to she'll hit problem spots, and we need to just kind of anticipate what they are, but she'll tell us. So we're making guesses that maybe if she has more water, she'll do better. Maybe if she walks more, she'll do better. We don't really know, but these are useful hypotheses. She will declare herself as time goes on. And some of the things we thought were important may not be. Other things that we didn't realize will turn out to be super important. And that just argues for being in as close touch with her as we can and asking her directly, what's your challenge? What's your obstacle for eating in a healthy way? And hopefully she'll tell you and you'll solve it. But congratulations, you obviously helped her probably more than any doctor she has ever seen. And you also gave her knowledge that she can carry forward.
I like to use I'll often tell patients that what we do together is MacGyvering, right? Like, you got the situation, you're trying to fix something, and you put something together with the tools you have, and sometimes it doesn't work, and you just go back and you reevaluate. And then when I really want to see people back is when things are not, I want to see when it's not going well. You don't need to get it perfect before you come back. Come back and we'll just kind of figure out together why it didn't work and where we might want to go next. And I always tell people when I put things on in their plan, always do a quick ask, make sure that they're on board with that. Does that sound like something you could do? Does that sound like that's something you would eat? Would you try that? And if there's hesitation at all, I'm like, okay, we're not going to put it on the list, right? Because it's just not going to work unless you've got buy-in from the person on it. So But yeah, we do a bunch of MacGyvering. I just saw somebody today, and there was a big MacGyver move because I didn't link. I didn't link his stress reduction to his need to track everything. So now he's doing how many sessions of meditation he's doing in his tracking app, and he's doing better. So it's just funny. You figure out where you screwed up, because if you have trust with somebody, then they'll let you know, and you do change. So thank you.
Yeah, great. Actually, I think we should, Kerry, can we move on, or?
Yeah, sure.
Do this next one in about
Okay.
half the time. That'd be great.
Well, this is much quicker
Okay.
patient, because this is a 33-year-old white female referred by primary care for lifestyle medicine consultation for obesity. She was not as heavy as my last patient. She had a body mass index in the 30s, but she had obesity, fatty liver, prediabetes, anxiety, depression, and known sleep apnea. So those 5 things were the same as the patient from earlier in the morning. She did not have hypertension, however. She did have GERD in addition, and psoriasis, but not psoriatic arthritis. And she had Stargardt's disease, which caused her to be declared legally blind. She did have some vision, but she was legally blind. She also had chronic hip pain from a fracture from a car accident about 10 years previous. Her goals, 3 of them were the same as our first patient: get to a healthier weight. And then as we were carving out, we added in reverse prediabetes and reverse the fatty liver disease. But she said something very specific in her intake forms. She wrote, "Enjoy life again," as one of her goals for her lifestyle medicine meeting with me. And that really stood out to me. Medication list, she's on famotidine 20 milligrams BID for her reflux, a meloxicam 15 milligrams daily for her chronic pain. She was on a multivitamin and a probiotic, Tylenol, PRN, and then also fish oil 3 times a day. And I actually don't know why she was on the fish oil. It might have been her triglycerides, although I don't use it for that, but I actually forgot to ask her why she was taking that, so my bad. Vitals and pertinence on her exam. She's 5'8", 227 pounds, BMI of 34, normal blood pressure without medication. Heart rate again was 96, so same as our other patient. Respiratory rate and O2 set were normal. She was obese, well-groomed, slightly tearful at times, somewhat flat affect. She did not have great eye contact, but she was legally blind. So I couldn't exactly read anything into the fact that she didn't have great eye contact. But exam was otherwise unremarkable. And again, her labs, her hemoglobin A1C was in the pre-diabetic range. Her fasting glucose was in the pre-diabetic range. Total cholesterol, her cholesterol ratio was less than the average risk for heart attack and slightly elevated triglycerides. So again, we're looking at all 6 aspects of her pillars for lifestyle medicine. I have them do an intake sheet before they come in, which helps me look at it quickly. And the nice thing about it is that when I see them doing really well in something, I can lead with that. So one of my philosophies is that always lead with where they're doing well, because most patients who come to see you for lifestyle medicine consultation feel bad about themselves because they know they are not doing the right things and have gotten themselves into some trouble. So in this case, for her fingers, she did not smoke, she didn't use any alcohol, and she didn't use any drugs. So I wanted to lead with that and tell her she got a big old A+ right from the get-go to give her something really positive to start with. Like, don't change any of those things, just keep that going. And she had another one that she was doing great on, and that was feet. She walks at least 5 days a week for at least 30 minutes, and she does Pilates 2 to 3 times a week for 30 minutes in addition. So I gave her an A on that one too. Yes, she could walk more than that, but when you're really trying to lead with what's good, I was really happy with this for her. So, and then again, we've really got to make sure you've got a good love motivation, right? So for her family was reliable. They would show up for her and do what she needed to, she needed them to do, but they were not emotionally supportive. She was estranged from her friends and from her family due to having a very abusive partner with whom she had broken up about 7 months prior to me first seeing her. And he had been really both verbally and physically abusive, and really just alienated her from all of her family and friends. She has not been able to work or drive or do most of the things that she used to love to do due to losing her vision. She did come up with a couple of positive things that she did love. She loved her dog, and she really liked to listen to books on tape. So those were the two positive things she could come up with in her life. In terms of sleep, she sleeps from 9 p.m. to 5 a.m. and she was pretty consistent. She falls asleep fine, but wakes up after about 3 to 4 hours and then has recurrent waking pattern every hour through the rest of the night. She does have sleep apnea, and I forgot to ask her if she was using her CPAP consistently. And that would be important to know, because if she's waking up after 3 to 4 hours because she can't stand her CPAP after that long, and she's waking up because she's having sleep apnea that's waking her up, that would be a problem. But I also saw that pattern for wakefulness, where you fall asleep okay, but repetitive waking as a sign that her serotonin levels might be really in the crapper, and that she might be significantly depressed, because that's a classic sleeping pattern for that. Stressors, she had a ton. This abusive boyfriend caused huge stress previously, and she still felt like she was having some PTSD symptoms from that. Her vision and all the limitations that has caused in her life. Her weight and other medical issues were a huge stressor for her. Having no emotional support from friends or family currently. And she had some significant financial stress as well. So basically, the abusive boyfriend helped her pay her bill. So when he finally got out, she can just barely cover her expenses on her disability income, and actually wasn't quite making it. She was making up for the deficit with using some savings, but she didn't have that many. And she owns a home, so she doesn't really want to get rid of her home. She also has a dog, so it's pretty hard to rent a place if she got rid of her house with having a dog. And the dog was the best thing in her life, so you really don't want to mess with the dog. So stress management, she fully admitted that she uses eating as a stress management tool. She definitely used it for comfort while she was in the abusive relationship, and without me prompting her, told me that she was using food during that relationship so she would gain weight, so she would disgust her ex enough that he would leave her. So this is really rare that you can get somebody who's that brutally honest with you about what they're doing with food. But I was really appreciative that she said that. But it's also a huge red flag that that if she loses weight, that may make her feel more unsafe. And so fully unpacking that with a good therapist was really high on my list. Because anybody who's got weight that they're using because of past abuse, the first 10 pounds they're happy about, and they get to the next 10 pounds that they lose, and they start feeling like they're going to be attacked. She loved to craft, although it was difficult for her to do the crafting because she couldn't see very well to do it. Listening to books on tape, walking her dog, spending time with friends, but currently they're all estranged, so she wasn't getting together with them. And basically, she had so few stress management tools that were healthy and so little that was good in her life. I really wanted to pull on any kind of potential spiritual background that she had. But she was Protestant by background, but she wasn't sure she believed in any higher power at that point. So I couldn't use that as anything for her to lean into. In terms of forks, fruit was 2 servings a day, veggies 1, whole grains none, beans none, potatoes none, walnuts and flax seeds none. Eggs none, dairy was 1 to 2. Meat and fish was once a day, processed foods 4 to 6 a day, 2 tablespoons of oil a day. So a whole lot of processed and animal-based things compared to whole plants. She did drink more water, 32 ounces. Caffeine was 1 to 2 cups a day. She uses Instacart for grocery delivery, which makes getting vegetables a little bit iffy because you're not picking them yourself. She has a limited ability to cook due to her eyesight. She has actually cut herself significantly several times trying to prep food, and she really was not willing to try again. She almost always orders 1 meal daily via Grubhub delivery service. Overall estimate of calories from whole food plants is about 10%. So we're going to put up poll questions 3 and also 4 together. So which one of the second patient's SU's lifestyle medicine pillars is the furthest off from optimal? And you've got several possible good answers here, right? Because we know it isn't fingers or feet, because she got an A and an A plus and an A on those. So my guess is we're going to have a few different answers for this one. And then the second question is, which of SU's lifestyle medicine pillars would be the top priorities when developing a lifestyle medicine plan for the next 6 weeks?
While we're waiting for those, let me just ask if Dr. Barnard has any comments at this point.
Okay. Yes. She has all these issues, but her problem really is food. It sounds like, and my feeling is that's where she needs to focus and needs her attention drawn. If she does paint a picture that sounds horrible for us, that she had this abusive boyfriend, but we don't really know what that means. He's been gone for more than half a year. And although she said to you, well, I ate to be disgusting to him, that could be true. But she also may have said that because that's the kind of thing people say, whether it's true or not. It may be, but it also might be used as a rationalization for what really is an addiction. This is a hypothesis, but she sounds to me like a person whose food is driving her weight problems and all her other issues. And she's also a person who is going to have lots of obstacles to getting on a healthy diet. So it sounds like she needs to first understand how food is affecting her. Kind of like the comment, I think, Bob, maybe you mentioned it earlier with the previous person who was avoiding carbohydrate and whatever. She may not know what causes weight and what will help her. So she needs some education. But then she also needs to come back in a week and every week to tell you about how it's going and how she's fallen off track. Kind of in the same way as people with other addictions need that constant support, because it's sort of like a journey through a forest. Every corner you go around, every curve you go around, you'll see a new obstacle that you weren't aware of at the beginning. And so as she starts out trying to do a plant-based diet, she doesn't know the problem she's going to have next Wednesday. And if she doesn't see you for another 6 weeks, we won't have solved her problem.
That's great. Thank you for that. Bob, can we show the poll, please? There we go. All right. So it looks like most people agreed with Dr. Barnard that forks was the biggest problem, although a lot of people thought that stress and love were issues.
If I were grading this, I would have given full credit for any three of those answers, It's just because they're all like huge, massive issues that she needs to address. And then for the two for priorities, let's see what people wrote for that one.
Basically, it was saying either forks and stress, or
We got this one, forks and love, forks and stress. Yeah. So I would have said that it's stress and love, and that's kind of how I approach this case. Whether it's right or wrong, I don't know. But let's go through and we'll kind of show you what I did and kind of what happened. So, like I said, the nice thing about this was that I didn't really know what was going to happen when we went through. So my initial plan for this patient, I strongly recommended that she worked with a counselor to process trauma and grief, certainly with the losing of her eyesight and so many things that she loved. I asked her to start every day with Dermot Willen's morning meditation. So if you don't know this already, it's a lovely 10-minute meditation for the morning. And it basically helps you to kind of just recenter for the day and have a focus for your day. And I put the website on here in case anybody wants to use that. She really liked books on tape. I asked her to listen to Pema Chodron's book, When Things Fall Apart. It talks about refocusing things that you're struggling with into opportunities rather than, oh, woe is me, versus how can you grow from this? How can you build from this? And then start working to reconnect with family and friends, because she definitely needs a lot more support than what she's getting. I asked her to try the gratitude review to help with falling back asleep or anytime as needed. She was very focused on what she had lost and was not very focused at all on what was still good in her life. So she didn't really have good positive motivators. And that was my biggest concern, was that she really didn't have enough of that to keep her going for very long. If mood was not improving with the above, consider starting antidepressant medication. I asked her to check out Daily Harvest for frozen delivered whole food plant-based meals that could just be heated up. So all she needed to do was to add a tablespoon of water to them and throw them in the microwave, and she didn't have to use any knives or anything. I'm not sure why I picked Daily Harvest for her rather than the Sweet Pea whole food plant-based delivery service that we've got around here. I'll suggest one or the other of them for people, but I don't really remember why I recommended that one. And then her 6-week follow-up. Basically, she didn't return for her 6-week follow-up appointment. She canceled and she did not reschedule. The nice thing about being in the Rochester Regional's health system is because her primary care doc was in the health system, so I could actually go into her chart. So I looked to see what had happened, and she had gone back and seen her PCP was put on an antidepressant medication and was set up with a counselor who she was seeing. And I did send her a message through our system, wishing her well, letting her know that she was very welcome to come back and see us whenever she felt ready to start working with us again. We did talk in that first visit that she really needed to make huge changes with her diet, but I thought we needed to work hard on getting some of the things out of the way that were going to make it hard for her to do that. And I didn't want to give her anything that would add to her stress, which is why if she's ordering food anyway, if she's ordering from Daily Harvest, that's not really any harder than ordering from somewhere else at the moment. So, from Grow Hub, at least she'll have something that's whole food, plant-based, and a little healthier. So that is it. I just have a picture of the pillars up there in case anybody needed a reminder, and we can have some more discussion.
Great. That was terrific, Kerry. Thank you so much. Yeah. I'm going to go back to our panel. I'm going to make an executive decision. We're going to go 5 minutes over. So we're going to quit at 8:35. Okay. Dr. Barnard, any more comments before we go to our other panelists?
Just several things really quickly. Because of her issues, I would have been inclined, I wonder if it might have been useful. It's hard to know because we don't have her in front of us, to make sure, first of all, that she has a knowledge base of what causes obesity. She might have thought it's carbohydrates that do it and that sugar causes prediabetes. And by the way, there's just another article came out in August showing that sugar intake is not associated with prediabetes, but in the public's mind it is. So it's important for her to have a knowledge base. And then if she were able to come in every week, even if it's by Zoom, even if it's just a group so that she has 3 or 4 minutes, one could ask her how she's doing with the completely plant-based diet that you've recommended, like penicillin for her. And she'll tell you the reasons why she can't do it. And then you can work through those, which may be stress, or it may be something else, or maybe she'll actually do it. Who knows? I would also let her know that if she heard that you need to have a good sharp knife in your kitchen, I would let her know that that's the worst culinary advice that people always give people, because you can cut tofu with a butter knife. And you don't have to, she can buy pre-cut vegetables and all this kind of stuff. She doesn't have to do that. But maybe the last thing just to say really quickly is if she comes back every week, and let's say she's part of a group in your clinic live or by Zoom, you've got built-in social support that for some people is easier than reconnecting with the family members who drove you crazy all your life. So she might have had a sense of support and even accountability of wanting to do well for these new folks who don't really judge her. So that would be something to see.
Great point.
And could even be offered now. Say, we're starting a new group. Come on in if you want to be part of it.
Yeah, great point.
Sure.
Yeah, that's good. Thank you. Dr. Sunderman, any thoughts?
Again, thank you, Dr. Graff, for another case and how different, right? About the same age and kind of they sound sort of similar. And wow, I just want to give this young woman a hug, right? I feel like she's really broken. And that quote about, enjoy life again. And I guess one question I want to ask her, like, when did you perceive stop enjoying life? And 2, what would that look like, right? Given your circumstances, we know that, your vision is bad or poor, but what does that look like? Does she even know what that looks like? Because it's interesting with her story because, with the feet, she's actually doing remarkably well, right? Despite these obstacles and really struggling, she's walking every day and she's doing Pilates. So this is a lot more than a lot of our patients are doing. And yet, she's able to do that. And she is quite courageous because despite losing a lot of her support because of this abusive relationship, she had the strength to then leave that relationship. And that was probably really the only close relationship she had, even though she knew it was toxic. So I feel like with her, you did a remarkable job with both of these patients, and she just has a lot of PTSD, a lot of deep psychological mental health issues. I think, it's great that she saw a primary care physician and then she was put on medication, right? Maybe that will help the mood, but I feel like there's a deeper story under there, like an onion peel, that really we need to get to the inner core. And like you said, I mean, she's focused on a lot of the loss and what she's lost in her life. And, just trying to get to her to say, what does life look like? And what do you want out of that? And really hearing her story. And I agree with Dr. Barnard about, the food and what a huge role that has. But in some ways, her food was her protector, or how she perceives it. And it's like one of the things that hasn't left her, right? Whenever she wants her Grubhub, it's there for her. It gets delivered to her. It feels good at the time. And it's the only consistent thing that she's had, and it's protected her. So I think that this is to not say anything about how you approach this, because I think this patient just, this individual just needs a lot of help, deeper than just a lifestyle medicine consult. And she'll come back, I bet. So thank you for sharing.
We'll see.
Yeah, great. Thanks for those comments. Dr. Brakey?
Yeah, I also keyed on that comment that her goal is to enjoy life again. And she clearly has two things that are keeping her from enjoying life. One is her vision, and one is her weight and the consequences that flow from that. And to think first on the vision, the Stargardt's disease, I didn't know a lot about it, but I looked it up. It's a genetic recessive trait that results in progressive central blindness, usually starting between age 6 and 12, but can have onset about age 20, and usually results in a pretty, toward the end, accelerating loss of central vision. And that's got to be that's got to be a huge loss for anybody. I know my mom was close to losing her vision, and she's 94 with macular degeneration. And she's like, that's like the thing I really want. And we all know our patients, especially if it's kind of, it's programmed in. Well, the traditional literature also says that it's untreatable, that it's uncurable. And again, I don't know for sure, but that's what we used to say about heart disease before 1990 with Dean Ornish. That's what we used to say about type 2 diabetes before Dr. Barnard's book, Reversing Diabetes. That's what we used to say about all 15 of our leading killers before Dr. Greger kind of delved into the literature. And what we do know about Stargardt's is that it's a progressive deposition of lipid at the macula. Well, what if you eliminate trans and saturated fats? Have been shown to help macular degeneration in general. What if we put her on a whole food plant-based diet and decreased inflammation in these hardworking retinal cells? What if we improved circulation there? Might she delay or even improve her vision, like we see with diabetic retinopathy? We used to think that was irreversible. And again, landmark studies have shown that can be helped. So again, back to what Dr. Barnard said is, her obesity was being taught how to eat wrong, was using foods to stress, and we need to undo that. And at the same time, although we can't give her false hope about her vision, there's no harm in improving the environment that her eyes are working in, and hopefully helping to help also for her vision. It certainly can't hurt. And I'll look forward to further research on whether, just like with macular degeneration, improving diet and adding goji berries can help the retina. She may have some help there too on this genetic disease.
Yeah, thank you for those comments, Dr. Brakey and Dr. Sunderman. Dr. Barnard, fantastic discussion, and Kerry, great presentation of both cases. I wish we had days instead of hours, or an hour to talk about these things. Just a few housekeeping things. As soon as this is over, you'll check your inbox and maybe your spam folder if necessary. You will receive an email from Rochester Lifestyle Medicine Institute with a link to a Google form. Once you fill that out, you will receive your 1 hour of CME. And if you do this all year, you'll get 10 because we take the summer off. So the next Lifestyle Medicine Grand Rounds is October 11th. And that's going to be with Dr. Tom Campbell, and yes, he is the son of Colin Campbell, who happens to live in Rochester. Kerry, if you could just stop sharing for a moment, please.
Oh, yeah, sorry.
Oh, that's all right. And I'm just going to share my screen briefly here. I just want to let people know this is a shameless self-promotion, we do run 3 facilitated programs, 7-day, a 15-day Whole Food Plant-Based Jumpstart, the Lift Project, and CHIP for any of your patients who need some help with the things that we talked about tonight. And I'm going to turn that off. And so we have a tradition, which is that we all unmute ourselves and we say goodnight, so we can hear from all over the country.
Before we go, Ted,
Sure.
Before we go, Ted, if you don't mind, I just want to take 10 seconds to say that there was something very remarkable about this last case. This was a difficult case. I agree with everything Bob said, but Dr. Graff did something really amazing. Not only did she reach out and do a very comprehensive.
Hang on a second. Bob, can you mute? There we go. Somebody needs to mute. Okay, let's try it again, Dr. Barnard.
Okay, forgive me for taking so much time.
No, listen, we're
just want to say one thing.
trying to respect your time. Go for it.
This is a difficult patient who's been through so much, but Dr. Graff did something really amazing here. Not only did she bring her in and ask her about all the other things that are affecting her life, but after the patient went away, you have no idea where she is or what's going on. She reached out to her in a way that was not demanding, not saying, come back here. It was just, we're here if you're ready. And how many medical offices can do something like that? So the patient feels no pressure, but just knowing that lifeline is there for me if I'm going to need that. So she may come back, she may not, but that's really just the best practice in medicine.
And thanks to you, when she comes back, I'll make sure she gets in a group. We don't really have anything running here at this point, but that's key. At the time she came in, we didn't have a weekly, our nurse who can do weekly coaching hadn't started yet. So that would have been a really great resource that I could have had her see her weekly, but we didn't have it available when she came. So yeah, but she would have definitely benefited from that. So thank you for those.
Yeah, great comments. Dr. Sodi, yes.
So I'm really in awe of how Dr. Graff really just embraced the whole story for both of these patients and recognized the individuality of their story and of their personal lives. The second patient really spoke to me. So Dr. Graff and I are colleagues. And in one of the programs that I thought might at some point be of use to this patient is a mindfulness-based stress reduction course, which is an 8-week program that was created by John Kabat-Zinn back in the 1970s, and really can help people with chronic anxiety, chronic depression, and chronic pain. And when I think about pain, I think about both emotional and physical pain. And so I really love how there's a gentleness that is really demanded of us when we need to connect with people who have experienced trauma, and to be respectful and mindful of where they might be in processing that trauma. So I think Dr. Graff did a remarkable job in keeping doors open and allowing that patient to kind of decide when she was willing to come into a space to explore it further. The fact that she's made changes and seeing a therapist is amazing. But the MBSR is a course that I think, whether it be online or in person, might be something that might kind of nurture her inner resilience and then further nurture her emotional and physical well-being.
I think another benefit about the MBSR is a lot of times, and I don't know how the virtual ones, the courses that I participated in is a group, right? So again, you get that group dynamic, which Dr. Barnard had mentioned. So I think that could be a benefit too, to make that connection and feel a part of something while learning those mindfulness skills.
Mm-hmm.
Great comment. Yeah. Anybody else have any final thoughts or more thoughts before we hang up? Well, this was nice. I enjoyed standing outside the lecture hall. And too late for coffee, but anyway. So, all right. So keep your eye out for that email so you can get your credit. We'll talk in a month. Bye-bye, everybody.
Thanks, Ted.
Bye. Have a great night, everyone.
Good night.